The project that we have for the poster presentation was in regards to improving HPV completion rates in our pediatric population. Our clinic had below average comparatively to the national average. So we did a quality improvement project to try to improve our low rates, which is an ongoing national issue. For our quality improvement project, we actually surveyed families to say, you know, what are our issues for not wanting to return to complete the series. It's a 3-shot series. And the 2 big issues were that it's a vaccination given to teenagers. Parents openly said that they were not going to pull their kids from school to come during physician hours to get this done. And the other thing was that parents openly acknowledged that they forget that it's a numerous dose vaccination series. So for helping to improve, we addressed both those issues. We actually developed since I did it during my residency, we had a resident-run clinic that we developed this evening hour clinic that was just resident-run. When you got the patient, brought him back, took the vitals, gave the shot, did everything. We did that for a few months, and then the second phase was initiating an automated reminder messaging system that would actually call families to say you need to bring your child back. The actual survey, I mean, it told us kind of what we already thought was the issues. We just wanted to make sure that in our patient population that we weren't having any other problems that we didn't kind of foresee. If it was a transportation issue, if it was anything else. And it didn't turn out, and our patient population was not an issue of transportation, it was just an issue of we didn't provide enough hours for them, and we need to somehow address that they're forgetful, which happens. So the QI project actually improved the completion rates from 30% up to now we're at 70%. We were at 1.90%, but kind of dropped off. The next phase that we're doing is that where I did my residency, it's Advocate Healthcare. The thing would be to roll that out throughout all of Advocate clinics because it was pretty successful. I think it's just more new and innovative ideas to try to continue working to improve the HPV completion rates. There's a lot of other things that can be implemented with that kind of systems using like new-based technology. I think physicians are a little bit dated in using new technology like texting, phone reminders, those type of things. We're not usually on the cutting edge of that. I think there's an education component, but it's also bringing that to the administration, saying this is something we need to address more. And I think like social media, using all those type of new age technologies are something we don't take full advantage of, that other fields do, not medical, but medical related. I think it's an up and coming thing.